Have you ever felt your hands or fingers tingling as if tiny needles were dancing beneath the skin? Or a numbness that seems to suck the sensation from your fingers, leaving them unfamiliar to the touch? If the answer is yes, you're not alone. This is a mystery that afflicts millions of people around the world and can be a warning sign that your body is sending. In today's video, we're going to delve into the 10 most common causes of numbness in the hands and fingers. You'll discover that sometimes what appears to be just a passing inconvenience can be a symptom of something more serious. Do you know what your body is trying to tell you? Numbness in the hands and fingers can be caused by a variety of factors, with one of the most common being nerve compression, which occurs when a nerve in the hand is pressed or compressed. A classic example is carpal tunnel syndrome, where the median nerve passing through the carpal tunnel in the wrist is compressed. This can happen due to repetitive hand movements, like typing or prolonged use of hand tools, resulting in numbness, tingling, or weakness in the fingers, especially the thumb, index, middle, and part of the ring finger. Factors such as inflammation, swelling, or anatomical changes can also contribute to this compression, affecting the sensitivity and function of the hands. Another common cause of numbness in the hands and fingers is peripheral neuropathy, a condition resulting from damage to peripheral nerves. This damage can be caused by a variety of factors, including diseases like diabetes, which significantly affect small blood vessels, compromising circulation and, consequently, nerve health. Exposure to toxins, vitamin deficiencies, especially from the B complex, and excessive alcohol consumption are also known factors contributing to peripheral neuropathy. In this condition, in addition to numbness, individuals may experience sensations of tingling, burning, and even pain in the hands and fingers, reflecting the alteration of normal nerve function. The third common cause of numbness in the hands and fingers is direct injury or trauma. When hands or fingers are injured, whether through accidents, falls, or even repetitive strain, nerve or surrounding tissue damage can occur. This can result in numbness due to the interruption of nerve signals that would normally be sent to the brain. In cases of fractures, sprains, or tissue injuries, such as muscles and ligaments, there may be swelling or scarring that also compresses the nerves. Furthermore, previous injuries, even if already healed, can leave nerve or tissue sequelae, leading to recurrent episodes of numbness or tingling in the hands and fingers. A significant fourth cause of numbness in the hands and fingers is the narrowing of blood vessels or poor circulation. This condition, often associated with cardiovascular diseases such as atherosclerosis, can reduce blood flow to various parts of the body, including the hands. When the hands and fingers do not receive enough blood, they can lose sensitivity and experience numbness. Additionally, conditions like Raynaud's syndrome, where blood vessels in the extremities, including the fingers, undergo exaggerated constriction in response to cold or stress, can also cause temporary numbness and a change in the color of the fingers. In all these cases, reduced blood flow affects the delivery of oxygen and necessary nutrients for normal nerve function. The fifth common cause of numbness in the hands and fingers may be rheumatoid arthritis, a chronic autoimmune disease that causes joint inflammation. This inflammation can lead to swelling in the finger and wrist joints, putting pressure on the nerves in the affected areas. As a result, individuals may experience numbness or tingling along with pain and stiffness in the hands. Rheumatoid arthritis not only affects the joints but can also cause nodules or thickening of tissues around the nerves, especially the median nerve, exacerbating the sensation of numbness. This condition is progressive and can worsen without proper treatment, affecting the mobility and functionality of the hands and fingers. The sixth potential cause of numbness in the hands and fingers is a deficiency of vitamins, particularly those from the B complex, such as B12, B6, and B1. These vitamins are essential for the health of the nervous system. Their absence can lead to changes in nerve function, resulting in symptoms like numbness, tingling, and even pain in the hands and fingers. This deficiency can be caused by an inadequate diet, certain medical conditions that affect nutrient absorption in the body, or prolonged use of certain medications. For example, vitamin B12 deficiency is often observed in strict vegetarians or people with pernicious anemia, an autoimmune condition that affects B12 absorption. Proper supplementation and dietary correction can improve these symptoms and prevent more serious damage to the nervous system. The seventh cause of numbness in the hands and fingers can be attributed to conditions that affect the spine, especially the cervical region. Problems such as herniated discs, spinal stenosis, or osteoarthritis in the cervical, neck, spine can lead to compression of the nerves that branch out to the hands and fingers. This nerve compression can cause numbness, tingling, or even pain radiating from the neck to the arms and hands. These conditions are often the result of age-related wear and tear, injuries, or prolonged improper posture, and can be exacerbated by factors such as heavy lifting or sudden neck movements. Treatment for these issues varies and may include physical therapy, pain medications, and, in more severe cases, surgery to relieve pressure on the nerves.
If what I shared so far has resonated with you, I have something special that will interest you. Don't miss the opportunity to transform your life and start living your healthiest self today. By acquiring the ebook Secrets to Unshakable Health, you will have a guide with practical and proven strategies for living a longer, disease-free life. Click on the link in the first pinned comment and discover the path to lasting and robust health.
The eighth cause of numbness in the hands and fingers can be thoracic outlet syndrome, a rare condition that occurs when the nerves or blood vessels between the clavicle and the first rib are compressed. This can happen due to anatomical anomalies, such as an extracervical rib or shortening of neck muscles, or due to traumas or repetitive activities that lead to changes in the thoracic outlet area. People with this syndrome may experience numbness, tingling, or weakness in the arms and hands, especially when raising their arms or holding their head tilted to one side for prolonged periods. Treatment may include physical therapy, changes in workplace ergonomics, or, in severe cases, surgery to relieve pressure on the affected nerves or blood vessels. The ninth cause of numbness in the hands and fingers can be attributed to overuse or repetitive movements. This condition, often seen in individuals performing repetitive hand tasks such as typing, playing musical instruments, or working with hand tools, is known as repetitive motion disorders or overuse syndrome. Over time, these constant movements can cause tension and inflammation in the muscles, tendons, and nerves of the hands and wrists. This can result in symptoms like numbness, tingling, and pain, affecting the normal function of the hands. Prevention and treatment include modifying the work environment, taking regular breaks to prevent overloading, stretching exercises, and, in some cases, using splints to immobilize and rest the affected areas. The 10th cause of numbness in the hands and fingers may be systemic medical conditions such as autoimmune or metabolic diseases. For example, diseases like lupus and multiple sclerosis can affect nerves in various ways, causing symptoms like numbness. Similarly, metabolic disorders like hypothyroidism can lead to an accumulation of substances in the body, such as mucopolysaccharides in the case of hypothyroidism, which can compress nerves. These systemic conditions often cause a range of symptoms beyond numbness, such as fatigue, weight changes, and skin problems. The diagnosis and treatment of these systemic conditions are crucial because proper management can help reduce or eliminate numbness in the hands and fingers, as well as treat other associated symptoms. The treatment for numbness in the hands and fingers depends on the underlying cause of the condition. Here are 5 of the main treatments that can be adopted. Physical therapy. Physical therapy is often prescribed to improve muscle strength, mobility, and blood circulation in the hands and arms. Physical therapists perform specific exercises, stretches, and massage techniques to relieve numbness and improve the function of the hands and fingers. Medications. In some cases, medications such as anti-inflammatories, pain relievers, or muscle relaxants may be recommended to alleviate pain and inflammation associated with numbness. Treating the underlying cause. Identifying and treating the underlying medical condition is crucial. For example, if numbness is due to diabetes, proper glycemic control is essential. Orthotics and splints. The use of orthotics or splints can help immobilize affected areas and reduce pressure on the nerves, thus relieving numbness. Surgery. In more severe cases, such as severe nerve compression or structural injuries, surgery may be necessary to relieve pressure on the nerves or correct anatomical problems. It is important to consult a doctor to determine the cause of numbness and receive the most appropriate treatment for your specific case. Timely treatment can help prevent complications and restore normal sensation and function in the hands and fingers. We conclude this health dose video by emphasizing the importance of understanding the top 10 causes of numbness in the hands and fingers. We hope that you now have a clearer view of the possible reasons behind this symptom. Always remember that numbness can be a warning sign for various medical conditions, and it is essential to seek out a healthcare professional for accurate diagnosis and proper treatment. If this content was helpful, don't forget to like and share it with others who may benefit. And if you haven't subscribed to the channel yet, please subscribe to receive more information about health and cardiology. Your health is our priority.